You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our socially distant technical producer, J.D. DeAngelis. This morning, Brad and I are joining you from the administrative offices, and our special guest is Dr. Brian Mathie, optometrist from the Roholt Vision Institute. Good morning, doctor, and welcome to the show.
Yeah, thanks, Paul and Brad. It's always great to join you too.
All right, this morning, there are several things we're going to talk about. And, as we age, there's several eye problems that become more common. They include cataracts, dry eyes, glaucoma, floaters, macular degeneration, and retinal detachment. All those things sound really scary. This morning, we're going to talk about some of these conditions and the advancements in technology that have made treating these options or these problems less invasive and easier than ever before.
So, doctor, you've been on the show before, but you should refresh our guest as to who you are and where you practice.
Yeah, so I'm Brian Mathie, and I've been lucky enough to practice in Northeast Ohio following a residency at the Ohio State University College of Optometry and the VA Medical Centers. So I work at Roholt Vision Institute. We have practices in North Canton, in Alliance, and in Canfield. And I'm the clinic director there. Love to help my patients see better, feel better, and talk to them about everything from Ohio State football to local activities, golf, tennis, and whatever else they might be interested in.
So as mentioned above, cataracts are a common age-related concern. Can you explain exactly what a cataract is?
Yeah, so a cataract is, and I was talking to Paul about this before we started, a cataract is something that will form in every single human being if they live long enough. So some people can develop these in their 20s or 30s. More commonly, it's around age 70. And a cataract is a cloudiness of the lens in the eye. The crystalline lens is a tiny structure about the size of an M&M or a small button that sits right behind the iris. Normally it's clear and it does 1/3 of the focusing power of our optical system. 2/3 of the focusing is done from the light hitting our cornea, and 1/3 of that is from the lens. That lens is bloodless, it's perfectly clear, but as we age, due to metabolism, due to ultraviolet light, due to other health changes, sometimes it goes from clear, like a clear window, to yellowish or even brownish, like a dirty window or a dirty windshield. And that cataract then will hinder light getting to the retina, which needs to capture the light and process the light. Interestingly, cataract is Latin for waterfall, because way back when people were naming diseases, the people who had cataracts described it as trying to look through a waterfall. That's how cloudy it was. So it's difficult to see through and needs to be removed to actually restore vision that people had earlier in their lives.
So I understand there's approximately 3 million cataract surgeries performed in the U.S. each year. How about advancements? Can you tell us about advancements made in the cataract surgery field?
Yeah, and I always like to talk a little bit about the past so that we can truly appreciate our current situation. As early as 40 years ago, people were going into hospitals, having cataract surgery, staying there for 3 days. They had sterile sandbags around their head and they weren't able to move. And the reason why they were there for so long and why they couldn't move is because the incision to take that cataract out was 13, 14 millimeters big. So this is a big incision. And if they move that or if they get a leak, it could really be dramatic for the eye. Well, now one of the biggest advancements is they're able to fold the lenses. So instead of having to take the cataract out as one piece, they take it out in small pieces. And to put a new lens in, they can fold it in thirds instead of putting one big lens in. So they can make this through a 3.5 millimeter incision, make this surgery done and successful. And so now, instead of staying there for 3 days, they can be on their way home within an hour and a half from walking into an outpatient facility. So these procedures, not only are they quicker healing, but the procedure itself is much faster and much safer than it ever was. And of course, they can utilize a laser, which they didn't have decades ago, and that can be even more precise than what the scalpel can be. And the medications are even better. One of the things we'll talk about as we go on is the lens implants that are available now. So it used to be just a standard lens, or even before that, there was no lens that was put in. And that's why you'd have the Coke bottle glasses. They take out a third of the focusing power. As I said, that lens comes out, and they didn't put anything back in. And so they needed really strong glasses after cataract surgery. Well, now we can pick a very precise lens implant, and many times people don't need glasses at all. So we'll pick a lens power that is better than ever. And the reason why it's better than ever is because we have better measuring devices to know exactly what power is needed to focus light on the retina. But we have multifocal or bifocal type intraocular lenses that can be put in the eye. And we have new technology that is called a light adjusted lens. And that's really fantastic technology that has just been brought to Northeast Ohio really in the last month by Roholt Vision.
When did the laser surgery actually come on the scene approximately? What year?
Yeah, so that's been around for several years, and it's great technology, and not everybody uses it at our facility. It is an option. It's not done on every cataract surgery, but it can be really beneficial in certain applications, making the incision and creating what's called a capsulorhexis, or an opening in the capsule that holds the lens in place, and even breaking up the cataract so that it can come out in little pieces. But that's an additional cost that most insurances, including Medicare, which is the #1 payer of cataract surgery probably in the world, but they don't pay for it. So it's an extra cost to the patients. And because we get great results without the laser, a lot of times patients will say, okay, I'll forego that additional cost. But it's been around for several years.
Well, is the recovery time longer if it's done scalpel wise, or?
Good question. No, it's really about the same. And the results are similar. They're a little bit better maybe with the laser in terms of perfection of incisions and capsulorhexis, but the recovery time will be about the same.
Okay, what about the light adjusted lens? It's fascinating sounds. Tell me how this brand new technology works.
Yeah, I think we might be the second or third clinic in the state
Or
of
should I go
Ohio.
back and have mine redone?
No, definitely not. I think we've got great results, and it's sort of like buying a computer. You could wait and say, I know they'll have a better computer next year, or an iPhone that'll be better next year, or you can benefit from that iPhone and computer this year and take advantage of that technology. You've had great vision for a while now, so I think that's something to be appreciated. But we do have some even greater technologies now, and this light adjusted lens is really great because everybody's going to heal a little bit differently. So I talked about precise measurements and getting really good results because of those precise measurements, but still each individual heals differently. As pharmacists, you certainly know that, and they respond to medications differently. So they could have a different end result, two people with the exact same power going in and the exact same surgery. So the light adjusted lens allows us to do surgery, have them heal, and then modify that lens once it's already in the eye to make it a little stronger, a little weaker, to take out astigmatism. And so that's a way to kind of perfect it. It's sort of like having a suit and giving them your measurements, but then the tailor going back and after you wear this thing, making it perfect just so it fits you precisely. So that's done with light.
So is this sort of like the lenses in glasses that adjust to the light, brighter, darker,
Yeah, so yeah.
Photo
So those,
grays or something they're called, or
yeah, so photochromics are the
yeah.
old glass lenses, and transition lenses are the newer ones where they actually will get dark when they're exposed to ultraviolet light. This
Okay.
is sort of along that line that the lens will change, but this has macromers or molecules in the lens that'll actually change shape and form bonds in different areas depending on where the light stimulates the lens. So if we say, okay, we need top to bottom a stronger prescription in that lens implant, that light will be focused there and it'll change the shape
Mm.
of that intraocular lens.
Man, that's amazing.
The interesting thing about that is patients, though, have to avoid locking in that power of the lens. So they'll have to wear sunglasses or light blocking lenses until that gets locked in.
I see. Amazing.
Dr.
So,
Roholt
which
just did a few of these. Sorry, Paul. Let me tell you that Dr. Roholt just did a few of these, and one of the patients that he did had radial keratotomy. And if you remember radial keratotomy from the 80s, that's where they make the incisions on the cornea. Well, over decades, that cornea can flatten and become less strong, and so surgical measurements may not be as precise for a patient who's healing like that. And that's a really good example of someone who benefits from a light adjusted lens, intraocular lens.
Jeez. So, which patients benefit the most from the use of the multifocal lens implants?
Yeah, so the multifocal intraocular lenses are great for people who just do not want to wear glasses at all. Like if you're somebody who doesn't mind sitting down and putting on readers when you are doing near activities, then that's fine. But there are some people who are just really averse to wearing any kind of reading glasses at all. The people who don't want to wear readers or socially motivated, that they just don't want to have glasses on their face, then they would be motivated to have a multifocal, because these patients really can function without glasses from the time they get up until they go to bed. They can read the newspaper, they can watch TV, they can drive, so they can do all of those things. And a lot of people that get these are hobby-oriented people who want to golf without glasses. They don't want to have to look down through a bifocal, and they don't want to have to put on readers to keep score on the scorecard, or tennis players, or people who like traveling a lot and don't want to have their glasses. So it helps them a great deal. There's a new lens, and not to promote a specific product, but we have a new one that's from Alcon, and it's called Panoptic Intraocular Lens. And in my opinion, it's the best results we've seen so far with a multifocal lens. People coming back and just being very, very happy with their results and loving the freedom that they have by not having to have glasses.
Okay, doctor, time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for staff care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Brian Mathie from Roholt Vision Institute. So, Doctor, how about the post-operative time? What can cataract patients expect in terms of medications and restrictions and ultimately improved vision?
Yeah, so it's been a nice change. When I first started, patients had to take medications for a month. They were prescribed 3 different medications that they would get, and now it's a much simpler process. One of the great benefits is we're the only clinic that uses what's called an easy drop method. The easy drop method injects some of these medications at the time of surgery, so patients don't have to apply them or use the drops themselves afterwards. They'll only use a non-steroidal anti-inflammatory eye drop because that one doesn't sit well in the eye. It's not well injected, but it can be used in drop formation. So they can expect to use less drops than people had to use prior years, and they can expect good comfort initially. Most of the patients see fairly well, even day 1, and day 2, 3, and beyond, it's very good vision. The thing I hear all the time is my vision is so much brighter and clearer than before, and I wish I had done this years ago. But we have had a few people who have said, especially some of the women who have said, I didn't know my house was so dusty or that I had so many wrinkles. So that's their own complaint. Their house is dustier and they have more wrinkles on their face after the cataract surgery, which is not caused by the surgery.
Well, now you should get into a whole new line of cosmetics.
Yeah, we might need to work with medicine stuff on what we could provide for them.
Oh, that's funny. What a riot. So, can you explain the cataract process at Roholt? Is it different from other clinics?
Yeah, in many ways, I think it is. And the main reason is because of our other specialties. We are a multi-specialty ophthalmology, optometry practice. And we've been doing refractive surgery since it was first available. And we're also a dry eye center of excellence. So we can incorporate these technologies and these fundamentals into something as important as cataract surgery. So refractive surgery and cataract surgery go hand in hand to get the absolute best results. If you don't have a good tear film, you are going to have less quality of vision afterwards. There was one study that was done that showed people who are going for cataract surgery, 80% of them had a clinically significant dry eye. So if you have a dry eye, it'll be less comfortable, it'll heal slower, and the quality of the vision, not necessarily how far down they can read, but the quality of those letters that they can see will be much worse. So we incorporate all of that into each and every surgical plan that we have. And I like to think that part of the difference too is the fact that it's a very personalized and professional experience. I'm sure that a lot of other clinics are the same, but I'm really proud of the staff, and from the time that they check in till they spend the time with the scheduler and all of their post-op visits, that they have a really good experience. And it's just personalized. It's everybody with the same goal. And I think they get that sense.
So, according to the latest census taken, 46% of Americans are age 45 and older. What technological breakthroughs do we have for this age group in terms of better near vision?
Yeah, so this has been the holy grail of eye care for a long time, because there are so many people who have difficulties with their near vision. And these are also people who are willing to pay for a better solution. So if you could come up with the perfect multifocal contact lens, it would be a huge hit. So this has been looked at for decades, really. And some of the options that we have are contact lenses that are bifocals, contact lenses that are monovision, meaning one eye sees far away and one eye sees up close. But we've got some more technological advancements too, including one that's called a camera. That's K-A-M-R-A, a camera corneal inlay. And this is an amazing device that goes between the layers of the cornea and allows somebody to see with their non-dominant eye, both distance and near. Dr. Megan Sommer at our practice has done a lot of these, and we get really good results with people who have good lighting. This increased depth of focus allows them to function without glasses almost all of the time. They might need some readers for really small print, extended work, but this camera corneal inlay is new technology that's available at our clinic. And then the other one that I like, that I already mentioned, is the multifocal IOLs. Those multifocal intraocular lenses, I think, are just a great way to go for anybody who wants to be glasses free after cataract surgery, and it allows them to see distance and near. What's unique about this Panoptic new one is it really is a trifocal. So now more than ever, people are using distance vision, near vision, but also computer vision or digital devices. And that distance requires a third power or a trifocal version. And that's what this allows patients to take advantage of. So it's a great combination and a really practical application of an intraocular lens.
Interesting. So it's the bottom of the hour, time for the news, Doctor. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, there are now 11 counties in Ohio at red level on the coronavirus map. Stark County has moved back from red to orange. President Trump questioning the need for new rules in the upcoming debates. The president kiboshed the idea in a tweet, asking why he would approve the rules when he, quote, easily won the last time. The Ohio High School
Sorry,
football
boss.
playoff pairings have been released. Games begin next Friday. To take a look at where all the local teams sit, visit WHBC.com. A big weekend of high school football on WHBC. The Sarshone Ford Radio Game of the Week tonight is Hoover at Jackson. The All Care Stadium show starts at 6. Kickoff is at 7. Then at noon tomorrow, our stadium show from Massillon as the Tigers host McKinley in the 131st meeting. We'll have the game for you right here on 1480 WHBC. Also on Mix 94.1 and online at WHBCSports.com. The TV replay set for 6 o'clock tomorrow night. Also, starting at 6 a.m. on Saturday, we'll replay some iconic Massillon-McKinley games for you right up to stadium show time at noon. More news coming up at 10 o'clock. I'm Pam Cook.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Partly cloudy skies continuing for the rest of the day with a shower in places. Cooler this afternoon with a high of 57 and becoming mostly cloudy and chilly tonight with a low of 40. Saturday, we'll have clouds and sunshine with a high of 56. Chilly Saturday night with plenty of clouds, low 42. Look for a bit of rain on Sunday. Cloudy skies otherwise, high 58. I'm Holly Holdren for News Talk 1480 WHBC.
Holly Holdren.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Okay, today we're talking to Dr. Brian Mathie from Roholt Vision, and we are discussing the latest advances in eye care. We've got a lot more to cover this morning, so let's get back to the show.
All right, Doctor, refractive surgery continues to be a growing part of vision correction nationally. Why do you think LASIK has been so popular for the correction of vision?
Well, I think the main reason is because it has been successful. So marketing is part of anything's growth, but the word of mouth is what has really sustained this and helped it grow over the last 25 years. And I think the reason why patients enjoy it so much is because of the freedom that it allows. So anybody who's worn glasses and had to try to do activities, whether it's sports or work, and have glasses slide down their nose or have contact lenses give them difficulties, then they could be thankful for the freedoms of not having that. And the other thing that we see a lot of is the security that it gives patients. One category that really appreciates LASIK are moms, and especially new moms who are worried about, say, a fire or hearing their kid cry out in the middle of the night and waking up, and if they couldn't find their glasses or couldn't put their contacts in, would they be able to do what they need to do at a moment's notice? And the other thing is professions. So firefighters, policemen, anybody who would really be hindered or it would be dangerous if they didn't see accurately. Those are people who are especially thankful to have LASIK and be free of glasses or contact lenses. And the other thing that I think has really helped drive that is people experience dry eyes or difficulties with contact lenses. And with LASIK, obviously you don't have that wicking of the tear film through the contact lenses, and it can be more comfortable. And there's even been studies that show that there's less risk of a corneal ulcer if you're not wearing the contact lenses, particularly extended wear contact lenses. So LASIK can be beneficial in a lot of ways. And again, the thing that I hear a lot from these patients is, boy, I wish I would have done it earlier, because it is a lifetime procedure. It never wears off. And usually people think about it like any major investment. They think about it and then decide to do it. And then they say they wish I would have done it a little sooner.
How long does it take to do LASIK?
About 30 minutes. So they'll come in and we do about 2 hours of testing. We make sure that they're a good candidate, and that's where all the time is really spent, is in making sure that they're a great candidate so we can come up with the perfect surgical plan. But then when they come in on surgery day, it's only about a half hour for doing both eyes.
So what's the procedure? I mean, what are we doing to the lens?
Yeah, so if we're talking about LASIK, we're strictly ablating or changing the corneal curvature. So with LASIK, when it was approved by the FDA in about 1996, there was a machine called a microkeratome that made a flap. It's almost like a thin planer that created a flap of the cornea. Then the middle of the cornea, called the stroma, would be lasered and recontoured. Then that flap would go back down. Well, nowadays, everybody uses a laser to create the flap, so it's even more precise. And that flap's laid down, the cornea is lasered, and that laser now is more precise than ever. We can have bigger optic zones, which is the area in the center that has better vision, and we can laser less cornea and get the same result. So overall, it's just a lot better technology, adding to better LASIK results and more patients being able to be treated than ever before.
So with all of these techniques that we're talking about this morning, there's no invasion of the eye into the pupil or the, part of the eye that adjusts the lighting and all that sort of thing.
Yeah, so the iris isn't affected in any of these. With cataract surgery, of course, that's intraocular. We have to go inside the eyeball to take that lens out and put a new one in. But for these procedures we're talking about right now, the camera and LASIK, that's done by just contouring the front surface of the eye. And one of the other technology advancements that's really just reassuring to patients is that we now have eye trackers or iris locked in mechanisms. So when that patient lays down on the operating table, the laser locks onto the eye. So even if they have a tiny eye movement, the laser moves with them. So they don't have to worry about being nervous and moving around. This is like the high-tech military locked in, moving with you laser. And so they can't have a complication that way. Because if they would have an extreme eye movement, the laser just won't fire. And as long as it's locked on, it can apply what it needs to apply.
So we're not using any sandbags here, huh?
No sandbags anymore.
Okay.
No.
Okay.
So how has the procedure of LASIK improved since it was first introduced in 1996?
So yeah, probably the major advancements have been the application of the laser and the fact that it can use less tissue to get the same result. And then the eye tracker is the other one that I just mentioned. Those bits of technology have just made things much, much more precise. Each pulse of laser is 1/25 millionths of an inch. So one pulse, that's all it does. So these pulses can be calculated to have a very exact final result so that you have the correct curvature of the cornea to focus the light accurately. So that's just gotten better every year since this was introduced. And you know, this is just a side note, but wouldn't you like to be the guy who invented this laser and came up with a system where when those lasers are used, he gets just a little bit of coin for each one.
Gosh.
But now these are used everywhere, every day.
Is that true?
And the guy who invented it can get a little pop every time. So yeah, it's great technology. And if you wanted to use it, that was the terms. And so that's been good for him.
Gosh.
So are there any other treatments beside LASIK for this purpose?
Yeah, the other great one that I believe Dr. Roholt was the first in Ohio to do this. And you can technology lover, and he always wants to be part of knowing what's best for the patient and what's new. And he's not afraid to go and just spend a weekend and learning everything he can about these technologies. This newest one is called SMILE, which is one of the most friendly technology names I can think of, but it stands for small incision lenticule extraction. So whereas LASIK creates a flap that is laid back and then the cornea is lasered, this goes through the cornea and creates this little lenticule or a wafer of corneal tissue. And then there's an incision made on the side of the cornea, and that little wafer can be pulled out, and the resulting cornea is the correct curvature and thickness to focus light. This is fascinating because it can do a lot higher prescriptions, whereas LASIK might be able to do people who are nearsighted up to, say, 7 units. This can do people who are up to 11 units nearsighted, and it affects the corneal nerves even less. So it has been showed to have less effect on people who have dry eyes. So this SMILE procedure is the latest and greatest, and in fact, it has taken over and become the #1 refractive surgery procedure in Europe, not in America yet, but it was approved there before America, and it actually, they're doing more of that than LASIK, at least that's what I've been told. So it's a great new procedure that's especially good for certain parameters, dry eye patients, and that's called the SMILE procedure.
All right, since we're talking about tech, how has technology improved for the detection of conditions like glaucoma?
So, yeah, changing gears, glaucoma is a condition that can instead, where LASIK and cataract surgery, we're talking about gaining sight, people seeing so much better. Glaucoma is a condition where the vision just gets worse and worse and worse. And our main goal is just to keep it where it is so that they don't lose sight over the years that they have left on the earth. And in terms of detection for glaucoma, when I was in school, we did peripheral vision tests and we looked at optic nerves directly. That was kind of what we had. Well, now we've got great technology that's actually measuring the nerve layer in the retina, so we can detect years ahead of peripheral vision loss, whether or not somebody has glaucoma. There's also ways of analyzing blood flow around the optic nerve, and we can do scans specifically where the fluid drains out at the front of the eye, where a lot of times we have restriction on the aqueous fluid or the fluid in the eyeball that causes the high pressure. So we have all of these ways of measuring the health of the optic nerve and the blood flow that we didn't have 20, 30 years ago.
What about advancements in treatment for glaucoma?
Yeah, so fortunately, those have also increased dramatically. So if somebody is detected with glaucoma, the main way of treating that is an eye drop once a day. And that's been the case for a while, but we have new and better eye drops than we did years ago. But there's also ways to treat it that we apply, including using a laser to increase the outflow of fluid in the eye, and that lowers the pressure. There's something called MIGS, which are micro-invasive surgical glaucoma procedures, and they allow better outflow of fluid too. So these lasers, these surgeries, and advanced eye drops are all ways to protect the health of the optic nerve for years going forward.
Amazing.
What about, well, we can take this up in the next section, I guess. There's a lot of blind people out there, and I know we've seen some sort of crazy inventions that, you know, hook up the optic nerve to a camera or something like that. Maybe we can kick that around for a second or two and when we come back, okay?
Okay.
You're listening to Health Matters with the Medicine Center Pharmacy. Our final break is here.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Off By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
We are back to the last segment of the show. We're talking with Dr. Brian Mathie from Roholt Vision Institute. Okay, dry eyes. I got them. Just about everybody who takes prescription drugs has them, I think, of sorts. 30 million Americans who suffer from dry eye. How's technology helping them?
Yeah. So fortunately, there have been a lot of advancements, and it's funny, when I when I graduated, dry eye was just such a small part of eye care, and now it's become a huge part. As you said, 30 million Americans, and that number is growing all the time. And that's because of medications. That's because we spend time on digital devices. It's because of the American diet. But all of these kind of contribute to the fact that the eyes are drier than they ever used to be. So we have become a dry eye center of excellence, and using technology has helped us to treat and detect these patients. Not just detect them, but to know whether their dry eye is because of they have poor production of tears, or because their tears evaporate too quickly, or they have a poor surface on which the tears set. That's all important because you treat these slightly differently. So our technology allows us to measure to the micron how thick the oily layer is of the tears. It allows us to look at their blinking, which is incredibly important, not just their blink, but whether or not they have complete blinks. Because if your eyelids don't touch when you blink, then you don't produce or squeeze out the oils that you're producing. So all of these are complicating factors in dry eye, and we have technology that measures all of this, even measuring the number of particles in tears and the inflammatory component in tears. So by having that information in front of us, then we can decide what kind of treatments would be best for an individual patient.
There was a product for a while, and I think it's kind of gone by the wayside, called Lacrocert, which was like a chip that you put in your eye for moisture or whatever. What happened to this product? Was it?
Yeah, actually, I have a couple patients who have used that, and unfortunately, they haven't been able to get it lately. So it's one of those things that have not been available because of production or whatever reason. But that's just one of many possible treatments for the dry eye, and that helped patients to have a little bit more tear production. It actually was inserted kind of between the eyeball and the eyelid, and it sounds like it would be uncomfortable, but there are a few patients where that really was a big change for them and a big help.
So what about after you determine the diagnosis and etiology of a dry eye? What's the next move?
Yeah, so the next move is using some tears like they can pick up at the medicine shop. That's always a good thing, and I recommend most people, even with just a super mild dry eye, would pick up, say, some artificial tears, good quality artificial tears at medicine shop, and use those every morning, because they haven't been bringing new tears to their eyes. But we have some technology that can help us in what to prescribe, and we have some eyelid treatments that are advanced. And when we got ours, we were, I think, the third one in the state of Ohio that actually treats these meibomian glands. These are the glands at the base of the lashes on the eyelids that secrete oils into your tear film. And if they're not functioning properly, your tears that you produce just evaporate very quickly. So you need to have that functioning properly. And there's even some other really cool things that we work with patients, and some of them need what's called autologous serum tears, where we assist in them getting their blood drawn. The serum is spun out of that, the growth factors and anti-inflammatory properties. These are used to make sterile tears added to saline, and they can basically use their own serum in part of the tears, and that helps some of these more severe dry eye patients. So there's a lot of different things that we can do, but it all hinges on what's causing the dry eye in the first place. And that's where technology comes into play to determine, why do you have dry eyes to start with.
What are the amniotic membranes, and how are they beneficial in treating dry eyes?
Yeah, amniotic membranes are something that a lot of people aren't familiar with. This is actually tissue that is recovered from planned C-sections, and moms have signed a consent that they will allow this amniotic membrane to be used for medical purposes. It's harvested, it's sterilized, it's screened, and then this has been used for years and years in like burn victims or scarring. This tissue that is surrounding this fetus is very special in terms of healing and growing. And if put on a severe dry eye patient or even a damaged cornea, it can allow healing to take place very quickly and very thoroughly. And it's one of the most fascinating things that we do. So again, for more severe cases, there's a dehydrated version and there's a cryopreserved, which has been frozen and it is applied as a moist tissue. Either of those can be used on the cornea, and they can be a big change for these patients who have severe dry eye or other corneal problems.
Okay, what about guys like me that have to use a teaspoonful of eye drops to get a drop in my eye? What's the proper technique for putting eye drops in your eye?
Yeah, and you know, I say people like you, Paul, it's a good thing. You've got a great, strong blink reflex, and that's going to protect your eyes most of the time. But when you have to put drops in, it's kind of a pain in the butt because you're missing the eye or you're blinking. But the best method is to go in front of like a makeup mirror or a magnifying mirror, pull down on the lateral or outside part of your eyelid. It'll create a little pocket, and just drop it in the pocket. If you try to come at your eye, then you're going to move more. But putting it in the lid from the side, a lot of times people tolerate that well. And as soon as you blink, that eyelid will squeegee it across the entire eye, and it's where it needs to be. So just get it in anywhere, and it'll go where it needs to go.
What about eye ointments? I know they've kind of fallen by the wayside too. There were many of them out there before.
Yeah, the ointments or even the gels that are thick, more viscous material, they're great for nighttime application because during the night the eyes can recover. But during the day, they're just not very practical because they really blur your vision.
Yeah.
Again, it's like through water and people can't function. But to use them at night, they are a good product and they should still be utilized by patients and even doctors recommending them. So I think they have a place. It's just not as convenient, and people will kind of revolt just because it's blurry.
For sure.
Why don't you give your addresses for your offices before we wrap up, Doctor?
Sure. We have one in North Canton on Mayfair Road. We're in Canfield on Manor Drive, and we're in Alliance in the Chase Bank building right there on State Street. So if they go to roholtvision.com, they can get all the details on phone numbers and making appointments and all of our locations.
Excellent.
Okay, we're pretty tough on time. How much time do we have left?
We're done.
We're done. Okay, thanks, Dr. Brian Mathie, optometrist. I can't get the word out. Can you say the word for me, Doctor?
Yeah, optometrist, Roholt Vision Institute.
Okay. A special thank you to our sponsors, Studio Arts and Glass and Mercy Medical Center, and our technical producer, J.D. DeAngelis. As always, thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy weekend. We'll see you right here again next Friday at 9:10 a.m. right here on News Talk 1480 WHBC. And thank you very much, Doctor.
Thanks, Paul.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy.